There's a number of different meters available for monitoring your blood sugar. They're all pretty similar in that they all require a finger stick or an arm stick. They all require a drop of blood in some form or fashion. There's been a lot of studies working on things with using other body fluids. I've heard of we're going to use a contact lens. No, those are quite panned out yet. So it still remains, you still have to either make a small finger puncture or a small puncture on your finger, your arm, your thigh, somewhere to obtain a drop of blood. All the different meters then, they all have pretty good instructions with them. I would make sure whichever one you pick, you get the instruction sheet out, read it so you know the particulars of it, make sure you understand how to put the blood on the strip, where you put the blood on the strip, the timing issues. Most of the meters are self-timed now, so you don't have to do a lot of, you have to watch the clock or anything. If you do have problems with it, there's always an 800 number you can call, or take it back to the provider. Take it to your healthcare provider, your diabetes educator, the nurse in your doctor's office, or maybe to the pharmacy where you bought it, and ask them to give you more information and help you through any type of stumbling blocks you might have. Once you've obtained the reading from your meter, you want to make sure, number one, another thing to assess when looking for a meter is that you can read the numbers properly. I'm sure you're also familiar with cell phones, and different cell phones have different backgrounds, different lighting, different sizes. So find one that has the appropriate functions that you need, as we would call them bells and whistles. Do you want one that you can also program in how much carbohydrates you ate? You can program in how much insulin you took. Do you just want the number and then take that number and write it into a logbook once you've obtained it? Now's the time to make a decision about what that number means. If that number was within your range, typically a normal blood sugar range is 80 to 120. If you have a lot of other problems, your doctor might say, well, let's go 100 to 140 for you, maybe 160, maybe. You have to talk again to your healthcare provider about that. Once you've determined that and you write it in your logbook, then make some decisions based on, did the last dose of insulin you took, did they give you the right kind of number? Are you getting the results you want? How much carbohydrates did you eat? You could look at things like the glycemic index with the kind of foods that you're eating. Can you start manipulating those somewhat and make decisions based on those blood sugar readings as to changes you might need to make either in your diet, your exercise, or your medications?